Hi everyone, I'm Kathiresan, fertility physician and Dr. Mom, and here to educate on fertility. In this video, we'll be talking about how do you know if you're ovulating. So let's talk about this today. First, what is ovulation? Ovulation is the release of the egg. Once the egg is released from the follicle, it will travel down the fallopian tube, and if intercourse happens around the same time, hopefully there'll be a sperm in the fallopian tube, and the egg and sperm will meet in the fallopian tube. The process of ovulation is preceded by something called the LH surge, and the LH surge happens about 24 to 36 hours prior to ovulation. It's important to have a good understanding of the menstrual cycle to understand more about ovulation. So for more information on the menstrual cycle, I will link a video here. The first thing that you can do to assess for ovulation is tracking your cycles. If your cycles are coming regularly, that means with a frequency of every 21 to 35 days, then that is reassuring for ovulation. If your cycles are coming outside this range, then that would be concerning that ovulation may not be predictably occurring, and I would recommend seeing a fertility specialist to get further workup to identify a cause potentially, and then how to treat it based on the cause identified. Now, if your cycles are regular, and there can be a little bit of variability, but as long as they're coming every 21 to 35 days, then how do you know when you're ovulating? So at the beginning of the cycle, there's something called the follicular phase. That's when the follicle's growing and the egg is growing and maturing within the follicle. After ovulation is the luteal phase. The luteal phase is consistent in its duration, and it should be about 12 to 14 days. The follicular phase can vary in its duration. So, for example, if your cycles are coming every 29 days, then assuming the luteal phase is 14 days, you should ovulate around cycle day 15. So this is how you can use your cycle length to determine when you might approximately be ovulating. The next test to assess for ovulation is basal body temperature. What this involves is taking your temperature first thing in the morning before you get out of bed and doing that for an entire cycle. If a woman is ovulating, what should happen is after ovulation, there is a rise in progesterone. That rise in progesterone correlates with a rise in basal body temperature. Now, a common misconception is that the most fertile time is when you see that rise in the basal body temperature. That is not true. The rise actually happens 1 week after ovulation, and ovulation is your fertile time. So again, the fertile time is about 7 days prior to when you see the rise in the basal body temperature. The goal should be to have intercourse prior to ovulation, the day of ovulation. Having intercourse after is going to be less effective because the egg is only viable for about 12 to 24 hours. So the basal body temperature is not an effective test to tell you when to have intercourse, but you could use it over a few cycles to establish your pattern so that you know approximately when you ovulate from that information. And then I would stop doing it and then continue to have intercourse with when you determined ovulation is around that time in future cycles. The last test to assess for ovulation is the ovulation predictor kit. This is detecting the LH surge, and the LH surge precedes ovulation by about 24 to 36 hours. So I usually recommend patients get a name brand ovulation predictor kit, such as Clear Blue Easy, and starting to use it during the fertile window. So that's the 6-day interval that precedes ovulation, and using it in the late afternoon, early evening hours, something like 4 to 10 p.m. The reason is the LH surge starts in the morning and it takes some time before it reaches the urine. So that's why we usually recommend checking it later in the day. Once you see that surge, you should have intercourse that day and the following day. And ovulation predictor kits are better compared to basal body temperature to predict ovulation for that cycle and to pinpoint when you should have intercourse for that cycle. That is it for this video. I hope you found it helpful. If you did, I hope you'll give the video a like. Don't forget to subscribe down below. If you have comments or questions, you can leave them for me there also. Thank you again so much for watching, and see you in the next video.